Good morning, everyone. The distraction of a headache is something we all know. Even if we don't experience it every day, we all know constant headaches can make it really difficult for us to get anything done. So, how do you know when it's time to seek help for your headache and also other neurological issues? To discuss all of this, we've invited Apollo's consultant neurologist, Dr. Sudhir Kumar, who's got over 20 years of experience in this field. Today, he'll be explaining to us some of the most common neurological disorders and the key ways to identify each one of them. So don't miss out on today's special episode of the Health Hour series. See you guys at 11 a.m. on Apollo 24/7's Facebook page and YouTube channel. Join in with your friends and family and ask all your questions live. The link is given below. See you guys soon.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste and a very warm welcome to all of you. This is Vidya Malavde and I'm super excited to be a part of this one-of-a-kind live health hour show, which has helped so many viewers connect with leading Apollo experts during the most difficult times. Through Health Hour, Apollo 24/7 aims to bring the best doctors from Apollo Hospital to your homes every Sunday so that you can discuss your health concerns and get answers to all of your health-related queries live. And if you want to avail the entire range of services by Apollo Hospitals from the comfort of your home, I strongly urge you download the Apollo 24/7 app. Here you can book virtual consultations with the best Apollo doctors, order your medicines online, and even get home sample collection for your lab tests, all with Busek tab. Let me also tell you a wonderful initiative started by Apollo Foundation called Saving the Child's Health Initiative that aims to provide the best pediatric healthcare to children in need at no cost. So if you wish to know more about it, please check the link in the description box or scan the QR code on the screen. Coming back to the show, today we are here to discuss a very important topic: headaches, brain stroke, and memory loss. Get to the root of it. I'm sure all of us have many questions like brain stroke, why are youth at risk? Tension headaches or a migraine? And how old do you need to be to have a stroke? To answer all of these and more, we have Dr. Sudhir Kumar, Senior Consultant Neurologist at the Apollo Hospitals, Jubilee Hills, Hyderabad. He's going to be here with us today. So start typing your questions and we'll take them up with Dr. Kumar one by one during the course of the show. Also, watch out for the quiz right after the Q&A session, where you can win exciting gifts, discount vouchers, and much more. Well, let me introduce Dr. Kumar to you. He's got over 20 years of experience in treating neurological disorders, area of special expertise in treating patients with migraine, stroke, epilepsy, and dementia. Member of the American Academy of Neurology. His main motto of medical practice: provide the best care, which is cost effective and also prompt. Author of several papers in national and international journals, and likes long distance running, traveling, singing, and is an avid nature lover. We have a lot in common, Doctor. Welcome to our show. It's a pleasure and an honor to have you with us today. Thank you so much for joining us.
Yeah, thank you, Vidyaji, for the nice introduction, and also I thank the Apollo 247 team to organize this, and also all the viewers. I'm sure you must be excited to have this show today. Thank you.
Yes, our privilege having you, Doctor. So I'm going to start with stroke. This is, I think, very dear to me as well because a very, very close friend of mine just went, or her husband actually just, and he was literally just about 40 something years old, who had a stroke. So, what are the common symptoms of a stroke, and how can a stroke be treated in the first few hours after the symptom onset?
Yes, I think it's a very important question because stroke is one of the top three leading causes of disability and death, other two being cancer and heart attacks. So, and the most important thing in
Oh,
stroke is to diagnose the stroke early because the treatments they work in the first 4.5 hours. So, the earlier we diagnose the stroke and
oh,
reach the hospital, best are the chances. So, to remember how stroke can be diagnosed, just remember acronym called FAST, FAST, where each letter, like letter F, stand
okay.
for the face. So when you see someone where face is crooked or gets deviated to one side, it could be a sign of stroke.
Yeah,
A stand for arms. If the person keeps the arms like that in front, and one side you see the arm
yeah,
dropping down, it suggests some kind of weakness, and that could also mean stroke.
okay.
And S stand for speech. So if someone talks so well, and then suddenly you see them fumbling, the words are
Right.
not clear, or you say
Slurring.
something but they're not able to understand. So the impairment of speech. So these three, and that last letter T stands for time, because time is important. Time is brain, and with each minute delay, several millions of brain nerves they die. So the earliest we can reach the hospital, and it's very
Wow.
easy. We just need a simple CT scan, and luckily today we have CT scans, in every street around our country. Luckily, so it can be diagnosed and it can be
Correct.
treated. And regarding the treatment, the best treatment is called as thrombolysis, where a medicine is injected in the vein, and that medicine can dissolve the clot in the brain. And as I said, if it is given in the first 4.5 hours after the symptom onset, recovery chances are very good because beyond that time, it doesn't work or it may work very little.
Right. Oh, that was fantastic, Doctor, because that was really nice and fast, actually. Thank you for that. Now, the next one is migraine. Now, this is something that I've also suffered with quite a lot in my life. So, how can migraines be diagnosed and how can they be effectively treated? And more importantly, can they be prevented?
Yes, so I think so you're not alone. Migraine affects almost 15% of women, and that too most of the younger women. So if you look at women from the age of say 15 to 45, so 3 out of 20 women have migraine.
Correct.
It is more common in women. Men have
Oh my
only say
God.
5% of men have. It's another thing. Women always blame,
Yeah.
because of men we get headache. That's jokes apart, but it is linked to hormones. That's why then migraine typically it
Right.
starts after puberty when the girls start their periods. the incidence or prevalence picks up,
Right.
and until menopause the migraine remains high and then it goes down. So that's, and also we have seen many women complaining that the headache frequency is more near about their periods times, 1 or 2 days before, during periods, or 1 or 2 days after. So
Right.
that suggests some kind of linkage to hormones. But and then your question was
Hormones.
how
Yeah.
we can diagnose migraine. So like in neurology,
Hmm.
most things we don't need to conduct any test. It can be diagnosed based on the symptoms. So if someone says that I have headache, which can be one side of the head or both sides, along with nausea or vomiting. So along with the headache, they feel like vomiting. Sometimes they actually vomit, and they don't tolerate light. So just
Hmm.
they want to put up the light, switch off the lights, and they don't like any kind of noise or voice also. Even if somebody wants to talk to them, they don't feel like answering. So these kind of symptoms, and headache should last for more than 4 hours. If headache comes and goes away in 1 or 2 minutes, it is not migraine. So if someone doesn't take any painkiller,
Correct.
and headache should go for more than 4 hours, and maximum is 72 hours. So if anyone fulfills these criteria of symptoms, it could be migraine. And once you meet a neurologist or any physician, they can confirm the diagnosis. Now, the question was, how we can prevent it, because prevention is better than cure, and many
How?
things people can do.
Yeah.
In that, the top three tips are very simple, but many people don't follow. One is eating food on time. So, and in that, the breakfast is the most important.
True.
So, because brain needs glucose, even if somebody is very fat and obese, so many times they just skip the meals.
Hmm.
But that's not the solution, because brain can't survive on the fat. It needs fresh food. So, timely meals, not skipping breakfast. The second thing is getting adequate amount of sleep. So you would think that sleep is the simplest thing. You just have to lie on the bed and close
Right.
eyes and get sleep. But that is the one of the rare commodities
No, not
nowadays,
simple.
because people want to have late night parties, restaurants. Then some we have to spend half an hour, 1 hour or
Just
more on
walk
the
also. Everybody's just walking.
yes, walking, yes, and more work hours are
Yeah.
extended to late nights. So the sleep timings have reduced, and that can increase the chances of migraine. And third factor is the stress. So if we
Hmm.
can minimize the stress, so today hardly anyone says that I'm totally happy, I have no stress. Almost everyone has some stress or the other due to work, family, personal. Somebody who's rich also, they want to become richer. A lot of things are there. So each person has stress of something different. So if stress can emit, so these three things can definitely reduce the risk of migraines. And if despite this, if headaches continue to affect somebody, there are good medicines to take care of them.
Right. So you're saying that even the hormonal migraines can be taken care with these three things if you do, is it?
Yes, definitely. So, at least 50% of headaches can reduce if people take care of these three simple things. And, sometimes there could be triggers also, like,
Right.
a lot of food stuff starting with C, like Chinese food, cakes, chocolates, too much of coffee. So some people are sensitive to them. So if they have these things, unfortunately, they are the good things in life. Most people want to enjoy these foods. But if someone's
Right.
headaches get triggered with these foodstuffs, they can minimize them. And that also can, and also some exposure
Correct.
to sunlight. People go to sunlight, and so they can have an umbrella or avoid sunlight. Then
Correct.
also they can reduce the chances
Right.
of getting migraines.
So, okay, just for my information, what is the difference between a headache and a migraine? You said if they last for more than 5 hours, then it's a migraine, right? To a few days.
Basically,
Otherwise, it's a headache if it
basically,
just comes and goes for an
yeah.
hour or so.
No, it's like this. So the commonest cause of headache is migraine. So other causes can be tension headache, and sometimes serious causes like brain tumor, brain strokes, brain fever. So if you look at, let's say, 100 people with headaches,
Right.
almost about 55 or 60 will have
Uh-huh.
migraines. About 30 of them have tension headaches. So these two are, they are called primary headaches. Like if you do brain scans in these people, it will be normal. Then the last 10% they have secondary
Hmm.
headaches. So that has all serious conditions like tumors, infections, clots. So fortunately for
Correct,
us, those
correct.
serious conditions are not so common. The common things are less serious, but
Right.
of course they also need treatment. Yes.
Correct, absolutely. Okay, moving on. Um, Coming to epilepsy. Now, can women with epilepsy get married and have give birth to normal children?
I think it is very important for our society, because what I have seen in my last 25 years as a doctor is that if a woman has a disease, somehow there is stigma attached, and especially if woman has epilepsy, they find it so
Yeah.
difficult to get married. Parents struggle to find a match. The moment they disclose that she has epilepsy, then the groom side, they chicken out. They
Hmm.
don't want to get married. They feel that there's something wrong with this girl.
True.
Why I should spoil my life or my future children's life? It's not like that. It's not like that. Epilepsy is like any other disease,
Hmm.
which can be easily treated, easily controlled. And the women with epilepsy, they can have as good a life as women without epilepsy. There's no difference whatsoever, even though studies have shown that they get married 5 years later. So if a woman doesn't have epilepsy, and if a woman has epilepsy, she takes 5 years longer to get married, to find a match.
To get
So
married.
medically, as a doctor, what I can
And you
say
have a
is that
normal babies after that also.
yes, they can have normal babies, they can get pregnant, they can get married. So they have all the same functions, everything similar, just like women without epilepsy.
Correct. Correct. So do this is another question. Do people with epilepsy have low IQ?
That is
Oh.
not true. So if epilepsy is not treated, let's say if a child is allowed to get repeated attacks of fits or convulsions, then few
Hmm.
brain nerves can
Hmm.
get damaged and they can have learning disability. But if a
Correct.
child is treated well, and is we have good medicines to control the
Hmm.
epileptic fits. If he's a well controlled child with epilepsy, their IQs are perfect. They do well in studies, and we have seen many toppers in schools who had epilepsy. So it's not so definitely it's not true that child or people with epilepsy have low IQs.
Wow. Okay. And here's another one of those only. Can surgery be effective in epilepsy patients who fail to respond to medicines?
About 65 to 70% people, they respond to medicine, so that still leaves about 30% of
Hmm.
people who do not respond adequately. And for them, surgery is an option. And now in India, there are many centers which
Right.
specialize in doing surgeries, including Apollo Hospital. So it's not that if medicines are not helping, it's not the end of the road for those people. Surgeries can definitely help.
Correct. Correct. So now I have a lot of questions that are coming in, and I'm just going to take all of them. So this is from Mr. Ram Kumar. Are these age-related problems? All these issues. And by the way, he's 75 years and 2 months and 24 days old. So we're
Okay,
talking about.
I think first of all we should not blame the age. So age alone doesn't cause any disease, whether it is stroke or dementia or whatever. Of course, certain conditions, they are more common in people who are older because the risk factors that cause them, like
Hmm.
BP and sugar, high BP and high sugar are the commonest risk factors for stroke, and they are more common in older people, so they
Oh.
get more strokes. Alzheimer's disease,
Hmm.
is a condition which can happen in older people more, but can also happen in younger people. So forgetfulness or memory loss is not a sign of just old age. So forgetting few things is
Right.
different, but if someone forgets their children's names or spouses names or the common places where they're used to going, that is not just due to old age. So in our country, we have seen people
Right.
who are just 60 or 65, and their children, so, oh, my father is old, that's why he's forgetting. So 60 and 65, they say old, but by definition old age is 75 and plus. So we should not label somebody who is 60 and 62 as old person. They still have a long way to go. If you call 60-year-old person as
Right.
old, what do you
They
call
still have a long way to
80-year-old
go.
person? Long way to go. Yes. So life
Right.
expectancy and survival rates have increased in India also. So if someone is forgetting,
Hmm.
more than normal, definitely it could be a sign of
Hmm.
dementia. And with proper diagnosis and treatment, they can get better.
Right, but is there any way, which is say natural to increase your memory or to take care of the
Yes.
memory? I think with so much information that is loaded onto us with social media, this, that, and the other, and the stresses, somehow I feel that even my memory is failing. And I am an actor, so I need to learn pages of lines and stand in front of the camera. So I feel sometimes that it can get difficult because your brain is so. I think the bandwidth has become so little.
No, I think you have been a good actress and we have enjoyed your movies. So, that aside. So basically, see,
Thank you.
many patients, come and ask us, doctor, give us a pill, give us a tablet, so that we can boost our memory. So that is not the correct method. There is no pill or, a tablet which can
Correct.
be given to increase memory. Things are simple, basically, like when we exercise, our muscles get better. Similarly, when we exercise our brains also get better. So how to exercise the brains? We have to utilize our brain. So doing things
Yes.
actively. So just sitting and watching a TV is not an active exercise for the brain. There somebody else is performing. So the actors or
Right.
actresses who are acting. So their brains are getting better by just
Mm.
passively watching not. So what people can do is, learn some new skill. So so learn a new skill, or,
Yes.
then it's never too late. So somebody who's in 50s or 60s, if somebody wanted to learn, let's say, singing or playing piano or some instrument, that no age is wrong. So they
Dancing.
can learn a new skill, dancing, or second thing is just normal exercises, because when somebody exercises, goes for a brisk walk or jogging or cycling, whatever, so that improves the blood flow in all parts of body, including brain. So that also helps. And stress,
Right.
which we have discussed before also. So stress has a negative effect on memory. So if somebody is preoccupied, thinking too much about negative stuff, then memory can fail, especially chronic stress. So being happy or avoiding stress can also improve memory. And not to forget sleep. It's interesting to note that most of our memory is consolidated during sleep. So, children who stay up late nights
Wow.
and try to crack the exams next day, they won't
Yeah.
crack the exams. It's the children who sleep well in the night before exams, they do well, because the consolidation of memory happens only during sleep. So, the good sleep is a key to good memory also. And there are certain foodstuffs which are,
That's
memory
a,
boosting. Yeah, please. You had
yeah.
some. Yeah.
No, no, that's exactly. I mean, that's phenomenal because I think everybody lets go of sleep the first thing. मुझे काम है, okay, I will sleep less. Tomorrow is exam, oh, I'll ratta maro, and then the sleep is the first thing to go out of of the window. And I think the most important thing, like you say, is sleep.
Yes.
Yeah. And you were saying
In fact,
food.
in fact, most
What is the
in fact
food that
most
we can
people
take
who,
care
yeah,
of?
food. If you look at foods, the certain foods like Mediterranean diet, diets which are good, rich in fish, and also omega 3, omega 6 fatty acids, and then we have this dry fruits like
Mhm.
almonds, and so many of these things are good for memory. And avoiding processed foods,
Yeah.
avoiding high salt intake, and this, because these can increase the risk of BP, and high BP has a negative effect on the brain. So high BP, high sugars, so foods that can increase our blood
Right.
pressure or blood sugar, we have to avoid them.
Maybe avoid the C's also, like you just mentioned before. The coffee
Yes,
and the Chinese and all of that. Right.
I think
So
once in a
now
while
the
is
next
fine, but not
question coming
repeatedly.
in
Yeah,
is from, not all the time, of course.
yeah.
Okay, the next question is from Ms. Shweta Karedi, and she says, right now I'm facing tingling and numbness in one side of the body. Second stroke in cerebellum, right hand difficult to eat, walking using walker, speech therapy is going on with app. So tingling and numbness of one side of the body.
I think what I can understand is that this person has already had a stroke. So when the strokes,
Right.
patients survive, they have multiple symptoms, and one of the symptoms can be tingling or numbness, especially one part of brain called thalamus. If that is affected, then the opposite side can
Hmm.
have tingling and numbness, and there are good medicines to take care of them. If she meets her neurologist, they will take care. And of course, she's doing physiotherapy, which is very good. So for
Hmm.
rehabilitation, and physiotherapy is the key to recovery in stroke patients. So she should continue that.
Right. So here's the next question. I think we have a lot of questions on migraines and headaches. So I'm just going to consolidate this. Mr. Malleshwara Rao Puri, Malpuri is asking this. I think we've already also explained a bit of this. Hi, sir. Good morning. Can you explain about migraine headache, symptoms of migraine headache, and precautions? And also, Shikha Agarwal says that headache every third, fourth day and generally on left side of the head. Get irritated so soon that I feel like crying always. So basically, generally migraines and headaches.
Yes, I think the at least first is to recognize that somebody has migraine, and we mentioned that if someone has headache lasting for more than 4 hours, along with nausea, vomiting, intolerance to light or noise, it could be migraine. And uh, and one should feel that there are good treatments available. So some patients come to us saying that, doctor, there is no cure, no treatment for migraine, so I decided to suffer. And I had a patient who suffered for 25 years, and then when she came to me, I just tried a
Oh
single
God.
tablet, and within a month, she was fine. She said, I never knew what a life can be without headaches, and now this 1 month life is different. So the people who have migraine, they should not lose hope. They should meet the doctor, and now we have excellent medicines. So we have discussed that, non-medical treatment like, adequate sleep, reducing stress, and timely meals. If despite that, if someone has headaches more than twice in a month, they need medications, and these medicines are safe. So don't worry about them. These medicines have been tested and they're in the market for 30 to 40 years. So instead of suffering silently at home, and this migraine is disabling disease. It's not simple because people have pain, and only
Yes.
those who suffer can make out that they are suffering. Even their spouses or colleagues at work, they cannot understand because pain cannot be seen. If somebody has some injury or fracture, it can be seen by everyone, so they get a lot of sympathy. But someone who has pain inside their
Correct.
head, nobody can see. They'll just say that you don't want to work, so you want to take off from the work. Or at home, if the housewife, she has headaches, the husband or the in-law may say, no, you don't want to work at home, so that's why you're saying that there's headache. So instead of suffering and at work and at home, they can take medicines, and depending on the
Hmm.
age group and other comorbid illnesses, the doctor will select the correct medicines, and then definitely they can become headache free.
Right, right. So I think that pretty much answers your questions, and I have still more questions about migraines. Miss Jyoti Reddy says, "I'm suffering from migraine, and I'm 21 years old. Please give me some suggestion to get rid of it. I'm suffering severely with this headache. Kindly give me remedies." I think the first remedy, like doctor said, just visit a neurologist or a doctor, and or even on our app, it's quite possible these days. With the Apollo
Yes.
24/7 app, you can get a consultation, and like he said, one small pill can help you, and it's without a side effect, so that could work. But is there anything, like you said, even food wise, I think exercise could be another important thing that people could follow. Exercise, yoga, meditation will also help with the stress as well, isn't it? Isn't that what you also think, doctor,
Yes.
along with the
I'll just
Mediterranean diet, of course?
Yeah, I will just mention one thing here. So regarding medicines, there are two types of medicines. One is medicines that reduce the pain. They are typically called painkillers. So I see many
Hmm.
people just taking painkillers. No, that is not the best option because
Right.
painkillers, we can take only a small number, limited amount without side effects. If one exceeds that number, it can have a lot of side effects like acidity, ulcer formation, liver damage, things like that. So the number of painkillers should be limited to two or three in a week, not more than that. So when I say pills for migraine, they are not
Right.
painkillers. They are medicines which prevent future headaches. So that is what one has to start. So patients who come to me, they have been taking painkillers.
Oh,
And one more thing is that those who take more painkillers, the painkillers can become pain givers also. So that is called analgesic overuse headache. If someone takes more than 15 tablets of painkillers in a
correct.
month, the painkillers will give back pain. So that's another thing to remember. And then your next question was about diet. Definitely, in that the most important is timely meals and not skipping breakfast, not delaying breakfast. And if any foodstuffs they trigger migraine, which I mentioned, like Chinese food, cakes, chocolates, cheese, too much of
Coffee.
coffee, then one has to avoid them. And then your thing was exercise. So exercise generally is good for migraine, but some if someone does vigorous exercise, like there are people who do Zumba aerobics for 1 hour at a
Right.
stretch. So those who have already have migraine, the migraines can get triggered with vigorous exercises.
Triggered,
So
of
not to lose
course.
hope, if someone is very very passionate about gym and exercising, they should not stop it. They should take anti-migraine treatment and then continue with their hobbies and interests. So that can be done. And
Correct.
finally, your question on yoga,
So
I think you are a much better person to answer about yoga and headaches than me.
no, I think that helped me as well. I think, like we were talking before the show started, also about so yogic practices will calm you down. You'll calm your mind down. More importantly, whether it's asanas or meditation. And the second thing that we were talking about was this gut-brain connection. Now, every time, like I said, I have been suffering from migraines at all. So certain food things that have actually helped me without taking any medicine, and have cured, sort of, to say, my headaches and stuff, would be something like, say, a ginger juice is something that I still take it, and I think that's coming from my family, where it's kind of helped us take care of my, because sometimes I just feel that your stomach is so connected to your brain, and if your stomach is upset, you can get a headache as well. So we were talking about those gut brain axis, or the vagus nerve as well, so would love you to explain some of that, doctor, which you explained so well to me.
Yeah, I think this gut and brain connection is for real. So about say 30 years back, I used to have patients, coming and saying that, doctor, when I get gas in my tummy, the gas travels to the brain, and then I get migraine headaches. So I used to wonder, and
Right.
how is it true? So, but now in the last 5 or 10 years, research has shown that there are actually nerve connections from the gut to the brain, and what people eat and what people don't eat. It has a lot of bearing on not only on migraine, but even other conditions like Alzheimer's disease and Parkinson's disease. So we have something called as healthy, microbes in the gut microbiome. And if we take care of those healthy bacteria,
Yes.
bacteria, when we think they only cause diseases, but that's not true. We have some healthy
Right.
bacteria in our gut, in our mouth, and some other parts where they protect us. And that depends on the kind of food that we eat. So certain, mainly the fresh fruits, green leafy vegetables, dry fruits. So the uncooked, unprocessed food, healthy food, many of them, they take care of that. And also the curds, and then Yakult. So these things are good for our gut. And if we take care of that,
Probiotics.
then the migraine and can be prevented. And also serious conditions like Alzheimer's disease, Parkinson's disease, and stroke risk also can be
Alzheimer's and
reduced.
Parkinson's. Right. So the next question is from Miss Vasudha Rani. Can ischemic stroke cause immediate death? And can
The
insomnia and lack of sleep at night cause stroke? These are the two questions.
Yeah, the regarding death, I mentioned in the beginning also. If you look at the four topmost causes of death today in the world, so they are cancer, heart attacks, brain strokes, and road traffic accidents. So stroke is one of the top four killers in the world, and especially if
Right.
untreated. So that is why we have to be prompt and and start treatment early. So now there's a lot of awareness
Right.
about heart attack. So if someone has chest pain or breathing problem, they immediately rush to the hospital. But that awareness is not about the
Correct.
neurological conditions. Even if someone has headaches, if someone has been having headaches for say 3 4 years, and today also similar headache, it could be migraine. But someone who never had headaches in their lifetime, first time in their life, if they have severe headache, that could be stroke also. And also if someone has, let's say,
Mm.
one side arm is weak, so what people say is that maybe I thought that I slept on my body on my hand, so the hand has become numb and not moving, so they wait for 1 to 2 hours for it
Yeah.
to improve. But generally it doesn't happen. If it becomes numb within a few minutes, the numbness goes away if it is due to pressure of our body. But if numbness and weakness is lasting for
Right.
more than 10 or 15 minutes, it could be stroke. So they have to rush immediately. And then untreated ischemic strokes can cause death, but if they are treated well, the death rate can be reduced to below
Mm.
10%, so 90% plus can be saved. And regarding question about
Mm.
sleep, it is very clear that lack of sleep is one of the major risk factors for stroke, and also the risk
Stroke.
factors for stroke like high blood pressure, diabetes. So many conditions
Mm.
are more in people who sleep say lesser than 6 hours. So 6.5 to seven,
Correct.
7 to 8 hours is the normal sleep at nights. So people doing night shift duties or
Correct.
shift duties, they also have more illnesses. So doing night shift duties once in a while is fine, but someone shouldn't do night shift duties for years together.
Oh, so this is very interesting for me. So sleeping in what is important, not you accommodating your sleep in the day. Because I think
Correct.
our body also works in the circadian rhythm of the sun, right? When it needs to
Yes.
shut down when the sun goes down. That's important, isn't that? Because we think that, okay,
Yeah.
I'm partying tonight and tomorrow it's Sunday, so I'll sleep on the day. It's fine. Not doesn't
No,
work
see,
like that.
the biological reason for that is the sleep hormone is called melatonin, and that is released from the
Correct.
gland called pineal gland, and that is secreted only from 9 p.m. to 11 p.m. So the correct time for the sleep onset, that is sleep to begin,
Oh.
is between 9 p.m. to 11 p.m. Now we are masters, human beings are masters. We can distort our bodies, distort our schedules, everything, and distort the earth, everything.
Right.
So we can, make the pineal gland say that, okay, fine, let the melatonin produce. I will not sleep. But if we do this for say even few days, the biological clock or the circadian
Yeah.
rhythm gets disturbed. And I have many people who so they're similar to jet lag. People who travel to, let's say, US or other continents, and so there, because timings are different, first few days there's difficulty in falling asleep. So same thing, if someone doesn't sleep on
Hmm.
time and parties till 2 o'clock or works till 2 o'clock, 3 o'clock, then if they want to sleep by 10 or 11, they don't get sleep. So it can, we can, one can distort it. And as you said, it's not the same as the daytime sleep is not as refreshing or as normal as the nighttime sleep. So basically, based on the sleep
Right.
pattern,
Absolutely.
there can be two patterns: early to bed, early to rise. So those people go to bed by 9:30, and they're awake by 3:34.
Right.
Or one can be late sleeper. Late sleeper means 11 p.m., not 2 or 3. So and then they
Not
need to get
later
up
than
by 6.
that.
Yeah, occasionally is fine, but
Yes.
not routinely.
Absolutely.
Yeah.
Not routine. Exactly. Absolutely. So the next question is from Ms. Kanchan Pandey. She's saying, सर ऊपर नीचे करने पर लेफ्ट राइट करने पर बहुत भयंकर दर्द होता है सर में. So
Yeah, I
ऊपर
think
नीचे लेफ्ट राइट करने पर बहुत दर्द होता है.
Yeah, I think there's something called as postural headache. So when somebody changes the posture,
Hmm.
so one thing is that she should check
हाँ.
her blood pressure whether any problem is there in the BP. So sometimes if BP fluctuations can cause that,
Okay.
and then we also have to look at the
Headache.
blood flow to the brains. So she needs to see a doctor, and it can be treated.
Hmm. Okay. The next question is from Ms. Vasudha Rani. She said, would like to know how brain stroke will attack if you have again and again headache problem.
I think what she means is
Okay.
that whether if somebody has repeated headaches, as in migraine, will that cause stroke? So
Correct.
that's a
Right.
distinction type of question for neurologists also. So basically, migraine alone can cause strokes, but fortunately, it is not common. It is very rare condition, and where migraines can cause strokes. But generally, if women who have
Hmm.
migraine and they have other risk factors, like if they're additionally smokers, or if if they are obese and they have high cholesterol or high blood pressure, so additional risk factors along with migraine can increase the risk of stroke. But migraine alone, the risk
Right.
is not very high, very slightly increased risk than say
Not
women
very
who
high.
don't have migraine. Yes.
Okay. Fair enough. I hope that answers your question, Vasudha ji. The next question is from Mr. Rajan. My wife is often suffering from headache, the pain radiating through the entire skull. When she gets backside of headache, she faces intolerable pain and rolling on the floor due to migraine.
Yes, I think he has very given a very good description of how severe migraines can be, how it affects the lifestyle, and so there is no need for her to suffer
Right.
like this, just because there are very good
Just
medicines and
go see
safe
the
medicines are
doctor.
there, and within 2 3 weeks of treatment, all this rolling and crying will stop.
Wow. Okay, so I think Mr. Rajan, please take your wife to your nearest Apollo hospital or just get on the app, Apollo 24/7 app. The next question again is a headache. I'm Karthik. I keep getting headaches often and my eyes become heavy and I get the pain on top part of my eyes. I recently got my eyes tested as well and the eye power seems to be fine.
Yes, in fact, the eye pain is very common in migraine. So pain in migraine can be in the eye, can be over the face also, can be at the back of the head, back of the neck, up to the shoulder. Because the nerve that gets affected in migraine is called trigeminal nerve, which supplies all these areas. So many times people go to eye
Hmm.
doctors, and then so they say eye problem generally causes lack of loss of vision or visual disturbances. So, so this also
Oh,
is migraine, and if somebody just has eye pain alone, that could also be migraine. And there is one subtype of migraine called as ocular migraine, where patients only have pain around the eyes, and sometimes they can also have visual disturbances, and eye checkups are normal. So the
okay.
treatment is along the same lines how we treat migraine. Same medicines help in this condition also.
Okay. But they will not affect the eyes, right? In the long run. I mean, if you keep getting the migraines, they might affect the eyes also.
No, it won't affect the eyes. There is a type of migraine, what we call migraine with visual aura. So, before getting the headaches, patients
Right.
can have visual symptoms like scintillating lights, something flashes of lights. So that will come
Right.
for 5 or 10 minutes, usually in one half of the field, not the entire field. And after that, 10 15 minutes of
Correct.
these visual flashes, then they start getting headaches, which last for several hours, and then feeling of nausea, everything. So that is called aura, visual aura.
Correct.
So generally, migraine and
Right.
and pain around the eyes, that won't affect the vision. But one thing to remember is that
Eyesight.
if
Okay.
someone
Fair
has
enough.
severe eye
Hmm.
pain, and so definitely once eye checkup is required, because things like glaucoma can also cause pain in the eye
Correct.
and also visual symptoms. And sometimes it may not
Headaches.
cause too much
Hmm.
pain. So one eye checkup can resolve this issue whether eyes are normal or not, and then anti-migraine drugs can help.
Correct. Okay. So the next question is from Sandhu AR. Good morning, doctor. Is there a connection between migraine and coloring our hair?
No, so I think, see, the huge industry which is thriving because of hair colors. So I don't want to disturb them. So basically, I think there is no proof medically that coloring or dyeing your hair causes
Right.
migraine. So that's that way it is safe. So it's a personal choice basically.
Okay. I- Right. I hope that answers your question. No connection. Okay. The next question is from Mr. Saravanan K. What is the difference between complex migraine aura and epileptic aura?
I think this person seems to be a medical student or maybe a doctor. But anyway, I think it's a good question. So basically, he wants to know how to differentiate migraine and epilepsy. So before that, why he asked this question is that migraine, the underlying pathophysiology or the mechanism for both are very similar.
Hmm.
So at one end we have migraine where people get headaches, and the other end of the spectrum people get epilepsy. And many drugs that we use for treating migraine and epilepsy are also common, like topiramate, sodium valproate. So these two drugs are used for treating both the conditions.
Hmm.
So basically, the
Right.
epileptic attacks, by definition, they are very short duration. They'll come for seconds to minutes. And as I mentioned, this
Hmm.
migraine attacks, they last for several hours. And even this aura, the visual
Hmm.
symptoms or the aura that comes in migraine, they last for 10 to 15 minutes. But epileptic attack, if it
Wow.
goes for 15 minutes, it is called something called status epilepticus, where the person will be unconscious. So epileptic attacks are very,
Absolutely.
very long duration, more than 10 minutes, are uncommon, and that's a medical emergency. But visual aura in migraine
Right.
is very common, and patients are fully conscious and aware. In epilepsy, they'll be having altered consciousness, they may become unconscious. Not in migraine the patients are alert, they don't become unconscious.
Right. Okay. So the next question is from Mr. Prithvi B. My father had right carotid artery, age 58, stenting done in 2016. He's still unable to speak properly. He's been using Ecospirit,
We have to understand two
right?
things here. One is that ecosprin, that is aspirin,
Hmm.
is a blood thinner, and stenting, both are done to
Correct.
prevent the next stroke. Next stroke. So he must have suffered a stroke
Hmm.
already, and these two things will prevent the next stroke. Now the speech was lost in the first stroke, and the stenting as well as aspirin, they don't help in the speech. So what can help is the speech therapy. So he should consult a rehabilitation specialist and a speech therapist, and with that the speech will gradually recover. It may not become normal, but
Right.
good recovery can be expected.
It would.
Not by medicines, yes.
Fair enough. Not by medicines. Okay. The next question is from Mr. Ajit Kumar. I suffered seizures last year. Neurologist prescribed me valproate 300 mg and later reduced to 200 mg. I took for 1 year. After 1 year, neurologist advised me for brain scanning and reported. Um, reported what?
Okay, there is no
Well,
question. So I think,
I guess question. Let's if you have anything to
okay,
give
I
Mr.
think
Ajit
what we
Kumar,
can,
please go
what,
ahead.
yeah,
Otherwise, then
I
I'll move
think,
on to the next one.
no, no, I think I'll just say, so one question people always ask is
Hmm.
for how long we have to continue medicines in epilepsy. So first is that it's a
Medicines.
long duration treatment. So between 3 to 5 years is the minimum. And if someone doesn't have at all any
Oh,
epileptic attack in these 3 to 5 years, then we give a trial of reducing the drug slowly and stopping. So no one should stop the medicines abruptly or
okay.
without doctor's advice. So so at that time, if suppose somebody had an abnormal MRI in the beginning, then the doctor may repeat the MRI to see that disease, whether it has, suppose infection was there, whether it has healed completely or not. So then the doctor may repeat the MRI. If the infection is healed, then he will reduce the dose gradually over the next few weeks, and then stop it. But
Correct.
if MRI still
Correct.
shows the infection, then the medicines may need to be continued for much
He
longer.
will not. Absolutely. Okay, the next question is from Ms. Swati. How to differentiate between sinus headache and migraines?
Again, it's a very important question. So sinus headaches generally are short duration. Many patients come to me saying, "Doctor, I have headaches for the last 5 years due to sinus." That is not common. Sinus means there is
Hmm.
infection in the nasal sinuses, paranasal sinuses, and so symptoms are blocked nose, running nose. and pain is mostly in the face, and especially more in the afternoons when they bend down. Headaches can be more. And they are fairly acute symptoms. They'll come with days to weeks of symptoms. Whereas in migraines, the symptoms can be for several months to years, and these symptoms are not there. They don't have blocked nose, running nose, and the fullness of the
Hmm.
face, and those feelings are not there. And they always have nausea or
Right.
vomiting, and they can't tolerate light or noise, which are missing in sinus headaches.
Oh, okay. All right. That was actually informative for me as well. Even I wanted to know that. Well, I hope that answers your question, Swati. The next question is from Mr. Narasimha Raju. Doctor, can you explain how diabetes is related to headache?
There is
Is
no
it
link
related
of
to
diabetes to
headache?
head. No, they are not related. But if suppose somebody has very low sugar, hypoglycemic attack, which is low
Ah,
sugar, that one of the symptoms can be headache.
correct.
But migraine and diabetes are not connected.
Okay, that's great actually to know. Next question is from Mr. Anirban Chatterjee. What are some good over-the-counter medicines for migraine prevention and cure?
I think for prevention,
I
there
think
is
one
no
should.
over-the-counter medicines. For pain, of course, paracetamol, which is taken over the counter, crocin or dolo, they can be used for mild headaches. But if someone is getting frequent
Right.
headaches, it's not a good idea to just continue them. Where to nowadays we have online option, you
Correct.
need not lose your time. Just log into app and consult the doctor.
Correct, absolutely. Please go consult the doctor. Next question is from Ms. Lalita. Children these days are facing growth related issues. Not only their physical growth is stunted, not only the physical growth is stunted, they are now not maturing too. We often hear that they fall ill very often, even adulteration and food. So, I guess what is there anything that they can do? I guess the doctor mentioned
I
about
think, yeah,
exercising
I
and
think it's not connected to our topic, but of course,
food.
children should be encouraged to play games. Nowadays, they are hooked onto, social media, internet,
Yes.
because schools are online. Of course, they can't avoid that, but some kind of, one game they
Hmm.
should play half an hour to 1 hour. And then many, nowadays we're hooked on to ordering foods, and then foods come prepared, so that may not be the best food. So still, home cooked food, and they're very finicky in having vegetables and fruits. We have to encourage them to have that. And so these are some of the things which parents can do. And also, playing some kind of games or and brain exercises, talking to people, so these things can help children avoid adulteration. Food is is a
Correct.
common problem, and I think it needs more solutions.
Correct. So the next question is from Mr. Saurabh Kumar Dubey. My sister, age 23, is facing neuro problem. She's preparing for competitive exam, but last 15 days she's facing a problem like migraine. She's not sleeping and saying there's a lot of pain. So I think a visit to a neurologist is the thing to do.
Yes, so I think she may be one of those girls who is studying till 3 a.m. in the morning, and also stressed about the outcome of the exam. So I think we have to enjoy the process.
Right.
Many students I meet, they get scared of exams because most people want to study for exams and score high marks. But the motto should be to
Right.
study for knowledge. And once they study routinely, irrespective of exams, then by the time exams come, they'll be fully prepared. And there's no need to study only 1 or 2 months before the exams. Study throughout the year, just 2 3 hours in a day.
Right.
That's enough. And don't worry about the outcome. Put in your best efforts. Because outcomes are cannot be controlled.
Correct. So the next question is from Mr. Kaju Satani. Sir, my brain MRI shows multiple white matter FARC. So is it the sign of any disease?
I think it's a good question, and also I think if he's a doctor, also
Hmm.
it's fine. So basically, in migraine patients, also sometimes we can get this white matter spots. So if someone doesn't have any symptoms whatsoever, and only had headaches, and this
Hmm.
scan was done, and these are the findings, it can go with migraine. But it can also be a sign of other diseases, like if somebody has lack of blood flow to brain called ischemia, and sometimes other conditions.
Hmm.
So it is always good for him to meet a doctor and discuss his symptoms if he has any symptoms. And if he has totally fine, no
Correct.
symptoms, only occasional headaches, then it can be passed off as part of migraine, and nothing to worry about that.
Next question is from Mr. Anantha Polisetti, my migraine triggers due to acidity. So, what is the best treatment for quick relief?
Yes, so I think we are talking
How to
about
take
gut
care of your
brain
acidity?
axis. Yeah, so gut brain. So I
Yes,
think here also one gut symptom causing the headaches, and it is common. So acidity basically, again, if you look at the cause of acidity, it is irregular meal timings, not sleeping well, delaying meals. So first she has to streamline her food and food habits, eating habits, and
correct.
sleep adequately. Reduce the stress. Stress produces lots of acid in the stomach. So if these things help, well and good. If not, then we have to take care of acidity. There are anti-acidity medicines
Correct.
and see if that helps. If that doesn't help, then we have to use anti-migraine medicines also. So these are the different 3 or 4 steps he has to follow.
So I think these days, anyways, with so much of this intermittent fasting that has taken over the world, everybody wants to skip breakfast. And they say, oh, I'm going to eat my dinner at say 7, 8, 9, 10 o'clock in the night, and then the next day I will eat it at straight away at 2 o'clock in the afternoon or 3 o'clock in the afternoon. So that also, I think, can, I mean, it's a great thing to do intermittent fasting. I do it too.
I th-
But I think your body needs to get adjusted to that bit by bit and not do it, in the first go for 18
Exactly. I
hours or
think,
something like that.
yeah, see this. I think what you said, intermittent fasting is very good, and research has shown that it can increase the lifespan also. And in fact, our ancestors, if you
Hmm.
go back to the history about say 200 years back, human beings
Yes,
used to eat only
upwas.
twice. So because there was not
Right.
much food at that time. Now today we have surplus of food. Everybody has a lot of food. So this eating thrice became a habit much later on. It was not there earlier. But I think breakfast is not the right
Right.
meal to skip because already you have fasted you've done fasting for 12 hours because if you had dinner at 9 and
Right.
morning 9 only 12 hours of fasting is there. So fasting, if you need to fast, have a good breakfast, skip your lunch, maybe have early dinner. So that could be, so you have breakfast by 9 or 9:30, skip your lunch and then have your dinner at
Right.
6:37. So that could be a better thing to do. So you don't have a longer gap in between, but not like skip breakfast means you are having 16 to 18 hours. As you said, with practice and practice, after several months someone may be able to do that. But I think to for the beginners, you
Right.
can skip your lunch and then have early dinner by 5:36 or 6:30.
I think I would completely recommend and identify with what you're saying, doctor. That's fantastic. Okay, moving on. The next question is, can you please explain about epilepsy, which
Epilepsy
we
is a
did actually
disease of brain.
already.
Yeah, disease of brain where people can get this jerky movements and what is called fits, and the person can become unconscious. And because they become unconscious, they can get
Hmm.
injured. If they are driving, they can have an accident. If they are in the pool, swimming pool, they can get drowned. So the worry is about more about the accidents. If someone is cooking, they can get burned by the gas or whatever. So the injuries due to the
But why
loss
does
of
it happen?
consciousness. Yes, so it is an abnormality in the brain. So if you look at our brain nerves, they are like electric wires. So always electricity is being conducted from one part to other part. And if there is short circuit or some problem in one of the nerves, then from that part electrical abnormal electrical impulses start, and that's what happens. So if you look at the common causes, about 50% times it is due to defective genes, transmitted from previous generation. So parents or grandparents, that is called idiopathic epilepsy or familial epilepsy. In another 30 to
Correct.
40% it is brain disease. So at the time of birth, some lack of oxygen to the brain or abnormal migration in nerves, sometimes infections like say tapeworm infection in the brain or TB infection in the brain, sometimes blood clots in the brain, head
Wow.
injury, people getting injured and that causes a scar in the brain. So these are, and tumors in some small percentage. So these are the various causes of
Hmm.
epilepsy.
Right. So I'm going to take just maybe one or two questions more before we get done. This question from Ms. Sandhu. Doctor, I'm female, 51 years old. Is migraine hereditary? My father had it, and I have it since my children's birth. Now the frequency and duration is lesser, though. Is it hereditary?
50% times it is hereditary, 50% times it is acquired. So in half the case they can blame their parents,
Oh,
but other half there is no one to blame. But parents give us good things also, so no point blaming. All the IQ is inherited,
correct.
the memory, the height, the many things come from parents, and so that includes some illnesses also.
Right. So the next question is from Mr. Narasimha Raju. Nowadays, most of them are facing brain strokes, even in younger adults. What is the reason for this? What do you suggest?
It's a it's a very
Think
important question. As I was telling, so 30 years back when I became doctor, our books
correct.
told that only those above 60 will get strokes. But now we are seeing people in 30s getting strokes. So the commonest risk
Yeah.
factors are high blood pressure. So high BP has increased now in youngsters. So it is
Hmm.
almost more common because people are eating, I think, more salty foods, more processed foods, more stress another factor
Right.
which was not there earlier. If you talk to previous generation, they never said that they are stressed. So today there is more money, more jobs, but that has also brought in more stress due to some reason. They don't go hand in hand, but
True.
generally if you think that somebody having good jobs, they should be happy. But even the person who's
Happy.
at the topmost jobs handling 300 employees under him, he's also stressed, and the lowmost employee also is stressed. He says, my manager gives me more work and very strict timelines, so I'm stressed. So more
Right.
stress, more processed foods, so high blood pressure, lack of sleep, these are some of the factors that is. And also our healthy,
Right.
this eating habits have changed. The exercise, everywhere,
True.
buildings have elevators, and for short distance people are using cars, so the walking and
Cars.
physical exercise
True.
also have gone down.
I think what I sort of said in the beginning, that you're a nature lover and you love going for long walks and running. I think that is really important because I think that nature, first of all, takes care of all of your stress. So even if you're in a high stress job, it's very important to take those few days off every few months to just go away and not be connected to, say, all your devices and etc etc. Just stay connected and be focused, maybe with you, your family, whatever makes you laugh, whatever makes you feel happy, and connect to nature, because I feel like that is the most healing thing that I've felt that in my life as well, when I was going through stress and tension. So this few days away from all the stresses and workplace and all the kitch pitch that happens is very important. Okay, last question I'm going to take now, is from Mr. Nutan Kumar. If someone has BP of 120/80, then also he or she can have brain hemorrhage, or for brain hemorrhage, BP should be higher. And if brain hemorrhage happen, then will patient live without treatment for 4 days?
See, there one thing is that high blood pressure is the commonest cause of brain hemorrhage, means bleeding in the brain. But
Correct.
it is not the only cause. That's why if people have normal BP also, they can have brain hemorrhage. And after high BP, the next commonest is something called aneurysm, where there's abnormal dilatation in one of the brain arteries, and that balloon will rupture, and so blood leaks out. So that is called aneurysmal
Hmm.
brain hemorrhage. And then some people who take blood
Correct.
thinners like say aspirin or clopidogrel or warfarin, so those medicines also in a small
Hmm.
percentage can cause brain hemorrhage. So they are the three major causes of brain hemorrhage. Then regarding the last question, whether they can survive for 4 days, if the hemorrhage is small, many times hemorrhage is not big, so they can survive and they can live happily without treatment also. But if the hemorrhage is big, then such people require urgent operation to save their lives.
Correct. Well, I hope that answered your question, Mr. Nutan Kumar. And now moving on, doctor, I would love you to us your top tips. Over to you.
Sure. So here are my top tips. So regarding migraine, it can be prevented without medicines by three things. One is ensure adequate sleep of say 6 to 7 hours at night, and then avoid all kinds of stress and eat timely meals. Don't skip your breakfast. So by just doing these three simple things, one can reduce the chances of getting migraines. Regarding stroke, I want to say that basically remember the acronym FAST, FAST. In that, F stands for face. If somebody has deviation of face to one side or one side facial weakness, it could mean stroke. A stands for arm. If you keep the arms in front and one side arm starts dropping down, suggests weakness of arms, and that can also mean stroke. S stands for speech. If someone has slurred speech or impaired, they cannot understand, that can also mean stroke. So if someone has these three symptoms, then T stands for time. They have to rush to the nearest hospital because early diagnosis is the key. And as soon as it can be diagnosed, we can give the clot buster drug, the injection to dissolve the clot. And regarding epilepsy, I want to say that people with epilepsy, and especially women with epilepsy, they are normal. They can have normal marriage, normal pregnancy, and they give rise to normal babies also. So we should reduce or avoid the stigma attached to the women with epilepsy and generally with epileptic patients. And all these conditions can be treated well if consulted the doctor properly and on time.
Thank you so very much for all of these insights, Doctor. Very well said. We've absolute honor to be talking with you today. Thank you so much for joining us.
Thank you. Thank you all the viewers. Thank you Vidyaji and thank you Apollo 247 team.
Thank you. All right, guys, and it's now time for the quiz. So hope you guys are ready. Let me give you a tip. Some of these questions will be very easy to answer if you have the Apollo 24/7 app on your phone. All you have to do is answer the questions over the chat. Winners' names will be announced by the end of the show. Winners to mail their contact details at marketing@apollo247.com and gift vouchers will be shared with you. Now, here are the three questions. What is the average weight of an adult brain? Once more, what is the average weight of an adult brain? Question number 2. When is the World Stroke Day? Once more, when is the World Stroke Day? Question number 3. Which premium membership plan of Apollo 27? I'm sorry, one more time. Which premium membership plan of Apollo 24/7 provides you with the benefits like free delivery of medicines, 24 hours emergency doctor on call, and many more? Once again, which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines, 24 hours emergency doctor on call, and many more? So before we move on to our winners, I have a very special message for all of our viewers. We are all well into our festive season, and this year, finally, there is happiness and positivity all around. But let's not forget that it's only because of the hard work and sacrifices of our frontline workers that we are here today. We have put together a little something to show our gratitude to our heroes, and we hope that they too get to celebrate this festival with their loved ones this time. Please find the link to watch it in this description below. For every share on the video, Apollo 24/7 will contribute rupees 100 to Saving a Child's Health Foundation. So let's come together to do our little bit for this good cause. Could we have the audio visual, please?
Surprise! इस बार मैं भी
मम्मा मम्मा पापा
इस बार मैं भी
ईद मुबारक भाई। इस बार मैं भी।
इस बार मैं भी
इस बार मैं भी
इस बार हर कोई मनाएगा त्योहारों की खुशियां अपनों के साथ। पिछले 2 साल से हमारे फ्रंटलाइन वर्कर्स की बदौलत ये मुमकिन हो पाया है कि हम सब अपनों के साथ हर त्योहार की खुशी बांट सके। इस बार हम आशा करते हैं कि वो भी त्योहारों की हर खुशी अपनों के साथ मना सके।
That video brought a smile to my face. I hope it brought a smile to yours as well. And now, in case you have any questions about vaccinations or any other health concerns, you can use the special coupon code HH247 to get rupees 199 off on your online consultation and 15% off on the medicine orders placed on Apollo 24/7 app. And now for the big moment. We've got the winners of the contest today. Our winner Number 1, Mr. Raj R. Winner number 2, Tejinder Jeet Singh Brar. And winner number 3, Mr. Karthik Singh Thakur. Congratulations to all our winners. And thank you so much, every viewer, for joining us and participating. And hope you found the information shared useful and would follow the amazing tips shared by Dr. Kumar. We want to say goodbye here, but we will be back with another important topic and an Apollo expert next Sunday at 11 a.m. So stay tuned and keep wearing that mask to stay safe. Goodbye and God bless.